I'm going to be talking to Professor Paul Tupper, who's the director of the Cognitive Science Program, the Department of Mathematics at Simon Fraser University, and part of the COVID modeling group. And we're going to be talking about COVID-19 transmissibility amongst kids, particularly the Delta variant. So welcome to the interview, Paul.
Thanks very much, Markham.
Well, I guess let's dive right into it. What is the difference between the original virus, which we understand was not, didn't infect a lot of kids, or at least they were asymptomatic, but now we have the Delta variant, which seems to be infect a lot of kids. So what are we looking at here?
So the one thing that we know about the Delta variant for sure is that it's much more transmissible. And so that means that, with the original variant, say you'd have a situation where maybe 2 people would be infected. With the Delta variant, you would expect maybe 4 people to be infected. So it's just much more transmissible. People are infecting more people. And that's why it's the vast majority of the variants that we see in BC, for example, are the Delta variant. There's also concern that it's causes more serious illness. There's more controversy around that, but it's certainly a possibility that we're going to see more illness among those who are infected.
So what about the infection of children with the Delta variant? Are they more likely to be infected?
So we don't know. I mean, the information isn't available right now specifically on children, but we have every reason to expect that it'll be the same among children as it is among adults. So the Delta rose while school was out in Canada, and so we're still going to have to see what happens. But there's every reason to believe that it will be, we'll see a lot more of the Delta in schools.
Now, in the modeling that you've done with the COVID modeling group, what does the model say about the rise of of Delta infections within BC schools?
Well, what we know is that if we have a certain level of restrictions and things are under control, and the level of the virus is declining, when the Delta comes in, then numbers are going to grow again. And we really expect that because schools have been out and schools get back into session, it's almost certain that we're going to see if schools are out, that's not going to be many opportunities for children to infect each other. But with schools in session, that's an important pathway. Now, it seems that kids are less infectious than adults, so that's good news. But just being less infectious doesn't mean non-infectious. So that's still something that's going to happen. So that's what's happening and what they're seeing in the southern US. So we have an advantage in BC in that our population has quite high vaccine uptake rates. And that means that if the adults that the children are with, or in the case of teenagers, if the teenagers are vaccinated, then that's a really huge help. That's the best tool we have to prevent infection. But in some parts of BC, vaccination rates aren't very high. So it differs quite a bit from the interior to the say Vancouver coastal. It's pretty certain that we're going to see transmission. We're going to see a lot of it. How much? We're still not sure.
So is it fair to say that if I was a parent with school-age children, and I was worried about this, that checking the infection rate in my community would be one of the metrics I could look at as to, when I'm assessing the risk? So yes. If the infection rate is high, then my child has a higher risk of getting, and if the infection rate is low, or the vaccination rate is high, then the risk is lower. Would that be fair?
That's fair to say. In fact, that's what I did with my own children in the spring. Is that when infection rates were high, we pulled our daughter out of school for that reason. So now my children are vaccinated, but younger children, of course, is not available yet. So that's still a concern.
Are there any other metrics that parents should be looking at, to assess risk for their kids?
I think following public health guidelines is a good one. Another one is, like, in your district, what's the vaccination rate? You can look that up. And it's very reassuring if the vaccination rate among adults and teenagers is higher. People are still getting vaccinated, so those numbers are going to change, and hopefully they'll increase further.
Any recommendations or ideas on what the BC government and schools should do, or maybe what they are doing to minimize infections?
A lot of the things that the BC government has put into place are good. So they put a lot of effort into having improving ventilation in schools. The masking mandates, I think, is very good. They're of course encouraging people to get vaccinated, and that's also very good. One thing I'd like to see more of is the use of rapid tests. And BC was sort of strangely reluctant to not use rapid tests. But an example where a rapid test could be used is if, often we're getting exposure notices in schools where they say, okay, your child is possibly exposed in your class, so please self-monitor for symptoms. So, I mean, we're already all self-monitoring for symptoms, hopefully, but maybe that is the time when we could ask people get a rapid test, because, that's not, we don't have the bandwidth to give everyone a PCR test all the time, or we wouldn't want to anyways, but rapid tests are now fairly cheap and available. And that could do a lot to prevent transmission. If we know earlier that someone is infected, that helps a lot. The problem is that we can spread COVID without having symptoms, and so there's a limit to how much symptomatic screening can do.
Just, I'm not sure if you know the answer to this, Paul, but I'll ask it anyway. I'm seeing from doctors on social media talk about how the most infections are spread from asymptomatic people. So they're infected and they don't know it. Does your modeling show that?
That's something that we use in a fact that we use to model. So when we make predictions, we make them based on that fact that we learn from doctors. Other groups have studied this, and so we assume generally, and this is what public health assumes too, that the 2 days before you develop symptoms are when you are still quite infectious, and so if people are isolating, they're able to isolate when they develop symptoms, then that makes sense that you'd expect most of the transmission happens before they have symptoms. It seems that some people never develop symptoms with COVID at all, and they seem to be somewhat less infectious, but I mean, there's still the fact that because they don't know they have COVID, they're more likely to engage in behavior that will transmit to others.
Well, Paul, thank you very much for this. Really appreciate your insights.
Thanks, Markham. It was a pleasure.